The next presentation in ways will carries on from some of those things Nikolai was saying. So I'm going to give an overview of two programs of work, services here in the UK. One is looking at work in Mendip, what Nikolai referred to as the through model. But also I want to sort of just showcase a bit of work which is carried out by a charity down in Dorset called Help and Care. We wanted to showcase these two projects because one, the through one, very much grew out of primary care and the work of some GPs and community people there. And the Dorset one, because it is located within a charity and it's a charity, a voluntary organisation which runs it. So look at two services which you could argue really do have a focus on loneliness, even though they are health-based. I'm going to start off just by saying where these two are. They're oddly enough to do sit. So they're down in the southwest of England. Down in Somerset, which is coloured in red, and Dorset, which is coloured in blue. Population, Somerset population just under 1 million, Dorset population just under 500,000. With the Somerset one, this is very much focused on one sort of specific area. Some of you might recognise Glastonbury for very different reasons. But Frome is based around about just near Wells here. Both counties are quite high rural populations, population densities are around sort of a couple of cities and smaller areas, and then quite widespread rural populations as well, with various levels of infrastructure. So quite a lot of issues in both these counties around people being connected. I also live close to these areas, and I know that getting a mobile signal on a telephone is pretty difficult. Getting access to broadband can be very problematic as well. Public transport is often extremely limited. So quite often in a lot of these rural areas, unless you've got a car or lucky enough to live in a place with a good connection, then all of these issues impact on particularly people who are older or limited mobility or lower incomes and things to actually get out and about and access services. I always like sharing this slide. It's just a reminder that clinical care represents about 20% of where we get health outcomes from. The rest are around things like how we behave, to what extent we follow a healthy diet, or we exercise, do we smoke or not, drug, alcohol use. Likewise, social economic factors, our employment, education, our sense of safety in the community, and in particular, our family and social support. And there's a really good study which actually shows that the extent that you have connections within your community and you feel linked are a real key indicator around sort of health outcomes and wellness, etc., even stronger than whether or not you smoke or not. So in terms of health outcomes, the social is really absolutely fundamental to good health outcomes. And we can see this, how this sort of begins to come together. So we mentioned the medical there. So medical is important, but the social and emotional are equally important. In terms of health outcomes, we have traditionally focused very much on the medical and ignore the social and emotional impact of it. And both of these projects I'm going to describe in a moment really address the social and the emotional side of health and well-being, and really just how by addressing those that leads to better health and well-being, improved health literacy, and improved mental health as well. We do have a long-term health condition. You know, our hours with a health and social care professional, where we're getting direct support, are extremely limited. whereas the rest of the time where we are managing our condition, that makes up the rest of the time. And this is a little illustration from a piece of work Year of Care did, another program in the UK, which really looked at how a lot of our support is very regimented, but our lives go through all different things in between that. And this is, again, on the right-hand side, picking up that study I showed earlier, that social relationships and social support, where you've got low social support, high social support, come out as a higher risk factor than smoking and things like cardiac rehab and physical activity, etc. So I've always been really struck by this, as how just to what extent loneliness, social isolation really does impact on health and well-being. And I think we've seen this a lot through the pandemic around particularly older people who've had their routines disrupted, the things which keep us going, the things which give us a reason to get up and motivated in the morning. Having all of that ended for a big proportion of the population has really impacted on people's health and well-being, losing those day-to-day interactions. This is, in a way, sort of sets out the various things which are going on in Mendip connectors in Frome. So there's a whole number of activities which have been done. There's a whole thing around knowing what's out there, what's actually out there in the community. Do you know what is in your local community? And so a key part of connecting people up, making sure people are connected, making sure that people are supported within communities, is knowing what's out there. And often, even in quite small areas, we find many different community groups, voluntary groups, peer support groups, whole range of different activity. And quite often, if we're not careful, they're quite hidden, but they can be quite hard to find, particularly for the people to access them. Hence the need for a website directory, which is available to everyone, a single place where all of this information sits. Everybody knows where it is, whether it's a GP, a social worker, the postman, the hairdresser, as Nikolai mentioned. It's all there. And in really simple language which is accessible as well. So back to this whole thing around health literacy, making sure that language is accessible and understandable. And it's really important that, what's out there, something we call in England social prescribing, linking people to those resources. If you're a GP or something, or you're working in a healthcare centre and you know that someone's struggling with loneliness, or suspect that there's issues going on which are much wider social issues rather than clinical, there's got to be a really easy way. As a healthcare professional, you can't spend 20 minutes going through a great big sort of list of addresses and things. So making sure that website directory is also linked into local healthcare systems as well. Coded on EMIS. EMIS is a system that healthcare workers use in England around being able to make referrals and this sort of thing. Communication, absolutely vital. Communicating what's out there. It's all very well having a great website and great directory, which is available to all, but again, people have got to understand that. So back to this thing around health literacy and what Christine was saying, that it's got to be tailored. So multiple channels of communication, social media, radio, newspaper, newsletter, ringing people up as well. We can't just rely on one medium. There has to be a whole range of them as well. The whole thing around community development, which sits around mapping what's out there. So understanding where there's potential gaps and looking at how we can fill those gaps. Some of the learning from Frome has quite often been that just sort of, small amount, or sort of 10 euros, 10 pounds, Nicola, I forget what the equivalent is, Danish kroner is, but small amounts of money can just help to hire a room or something, link people up. a support group around, say, maybe leg ulcers or walking groups and this sort of thing. Sometimes they just need a tiny little bit of money just to help them get up and started. And from then on, they often manage themselves perfectly well. Group support, 198 talking cafes across Mendip where people can be signposted. Talking cafes are a great idea, which is being picked up in many other places. It's just quite simply, as it says, a cafe where a couple of volunteers sit there. They normally have a badge on them saying, talk to me. People can just drop in. They can get a cup of coffee. If they want to talk to someone, they can. If they don't want to and they just want to sit there quietly with a coffee, they can as well. There's designated tables. Often this is part of a commercial cafe or a community group where people already go. There's a chance for people to be signposted to other resources and to make friends as well in a non-threatening way. Clearly, COVID-19, coronavirus, has had a huge impact on these sorts of things. So I just want to give an example of how, by having these networks and having these what we call community connectors. So I'm just going to mention community connectors first. So in Mendip, Nikolai mentioned sort of a hairdresser and this sort of thing being trained. Done similar things here. Nearly 1,500 people have had training on how to start up a conversation. If you're a hairdresser, a post person, police, fire brigade, even trained people who are homeless as well, to have a conversation with other people and just to be able to tell them, did you know there's a lot of support out there, and this is where you can potentially access it. One of the things that they did in Frome with the lockdown and things, with the ending of things like the talking cafes and all the groups and everything else where people were connecting up, what they found was that actually for a small amount of money, they could get enough leaflets printed to go through every single letterbox in the town to every single person, with information around online services and telephone numbers they could ring for support and where they could help and everything. And using this whole mass of community connectors, those leaflets were distributed within a couple of days. Everybody got one through the letterbox. So these networks of people, these networks of volunteers are absolutely fundamental to supporting stuff within the community. You do need a systematic approach to this. This isn't ad hoc. You need people who can drive it forward. Very much in this area is driven by started very much by a GP who very much recognised that a lot of the issues coming through her surgery on a day-to-day basis weren't anything she could do about as a GP. There are social issues, however, they were fundamentally impacting on the health and well-being of the people she was seeing in her surgery on a day-to-day basis. They're affecting their diabetes, they're affecting their cardiovascular and everything else through diet. She recognized very much that people who are lonely have higher levels of depression. If you have higher levels of depression, your diet tends to be not so good. She really recognized these sort of cycles which were going on, and was instrumental in securing funding and developing the whole connecting network. And this is a mixture of paid employees who do this social prescribing and a network of volunteers as well. And this model, there's a number of links here. It's been cited in many areas. And there's lots of similar ones as well. Frome's been very good at sort of capturing some of the headlines around it, but the principles remain the same. And the extent this has now been recognized means that these approaches in England is called social prescribing, is now core funded by the NHS for rollout across the whole of England to ensure that in every area there is a link worker, there is a social prescriber who can support people, understand what's important to the individual, what matters to them, and connect them to local support and local services as well. So it really is about the power of communities to support each other and spread information as well. Now I just want to come on to the service in Dorset, down in the southwest. Again, a mixture of a very rural community, but also a city population as well. This is run by an organisation called Health and Care, who's a local charity. Who is very much as the name says. This service was originally commissioned by the local health commissioning group, what's called a clinical commissioning group in England, and it started off as a health coaching service. And then more recently, it's expanded to also include social prescribing as well. And again, this acts on the whole idea of a single point of access. So wherever you are, whether you're coming across this service via a website, through a telephone, a referral by a GP, something you've heard in the community or something, it all comes through to a single point. Someone has a conversation with that individual, and from that understand where best to support that person and how to sort of signpost it that person as well. So a single point of access. This service comprises of health coaches who provide dedicated one-to-one support for people. So those people with the lowest sort of health literacy, supporting them to build the confidence, knowledge and skills needed to deal with the day-to-day issues of managing and improving health and well-being, and really supporting people to build up their self-confidence through using sort of skills such as motivational interviewing, behavior change, and just really walking along beside them. So that's a health coaching element. Then there's a social prescribing element, which is similar to Froome, the whole thing around linking people to support in the community, linking people to other people, linking people to other people who have a similar experience, who maybe sort of had a similar life experience as well, and putting in place that support. This might be around finances, it might be around people dealing with grief, feeling vulnerable, having a long-term health conditions, issues around mobility and what have you. Can be a whole number of issues which might be a reason why someone contacts us this service. And we know that by supporting people with those issues, that has much supporting them to have improved health literacy, improved confidence, all of that feeds through to improved health and well-being outcomes, and also the way people use health care services as well. Again, I think it's a person-centered approach, what we call a personalized care approach. So moving from this idea of language of person-centered, which David sort of mentioned earlier, still puts someone sort of very much in the center, to much more a partnership approach. And I guess a fundamental here is finding out what matters most to the person, what is important to that individual, and then working with them to support them to either maintain what's important in their lives or support them to achieve what's important as well. And this might be through practical housing, job, finances, food, looking at current support networks and looking and understand the gaps and things, identifying community support, resources, befriending activities and different organizations, and really sort of supporting that person through that process. So quite often people come into these services with very low self-confidence or self-efficacy, low knowledge around managing their health, so very low health literacy, and quite often a real sense of what's the point, what's the point? Nothing's worked before. So the health coaches really work with these people to build that back up again, and with the social prescribing as well, to link them to the resources in the community. So that's a brief overview of those two sort of services, quite similar in some ways, but also quite different in some ways as well. But some common principles: a single point of access, a single point. I have to excuse my dog coughing in the background. And this whole thing around focusing on what's important to the person. So not necessarily the clinical needs or wider things, but understanding in the person's own words what's important to them, what matters to them, and supporting them to maintain that in their life and often rebuild that in their lives as well.